Assalamu alaikum. We had a beautiful evening in Lahore. Today is 15th of November 2025. So, health sector is one of the most important sector as far as human capital is concerned. And human capital is foundational to labor productivity, and that in turn would be very important for the countries or nation states propensity to innovate, the level of creativity they can practice, and of course democratic values, because healthy and educated population is empowered population, and then they can confirm for their rights, and they can represent themselves within the Committee of Nations with they can promote democratic values, or they can contribute towards international development policies as European nation, American nation, Canadian, which is associated as the North or developed part of the world, would generally contribute to. Whereas in the United States of America, it is considered that health sector is relatively facing a lot of inefficiencies when compared to health facilitation or health sector in Canada, or for example in Europe. These inefficiencies were pointed out yesterday by President Donald Trump while saying that insurance companies and their stocks have increased 1,000 times, but the inefficiencies remain. And the idea he has given, the solution he has given, is one of the best ones as far as economics literature is concerned. He would say that the Trump administration and his government would make direct cash transfers to the American citizens. So instead of reimbursing the amount to the insurance companies, they would allow the citizens to decide about their own insurance plans as far as health facilitation is concerned. That idea represent the idea that is recently floated by Esther Duflo in her TED talk. She's a Nobel Laureate. She's a French economist, and she is associated with MIT. And her randomized control trials and randomized control experiments, whereby cash transfers have been made to poor localities in Africa, would suggest that the citizens, the local community, would really utilize it in one of the most efficient ways, and thereby this idea that direct cash transfers should be made to American citizens is far more efficient than what currently Obamacare or Affordable Health Act practices. So but then of course Obamacare or Affordable Health Act by default means that it is directed towards the people, to the American citizens who do not really afford expensive health care facilities, thereby or cannot afford costly insurance schemes. So that needs to be worked out. But as far as the idea is concerned, it is a brilliant idea, echoed by the work of MIT and one of the most scientific works in economics, and especially the works of one of the most prominent economists, Esther Duflo. So all the best to American citizens, and because Democrats have really made this an issue, and they are standing for the rights of poor American communities, to then allow them to have affordable health care. And that's very important stand any national or global leader can work on for empowering the communities.